Hi friends, Dr. Sitesh Roy, immunologist, allergist, coming to you with the next video on coronavirus on what are the myths surrounding it. There are several of them. So as this disease has spread across the globe, affecting over 90,000 people and unfortunately taking about 3,000 lives already, we really need to know what works, what doesn't work, what's real, what's unreal. So let's see what we have in the list. The first one. The question comes up many times. People think that using a hand dryer, a hot dryer in which after you wash your hands, you dry your hands, is enough to kill the coronavirus. That is not true. Heat alone cannot kill it, and you absolutely need to use soap and water to wash your hands or need to use a hand sanitizer. The second one, does ultraviolet light exposure kill the coronavirus? Certainly for an individual or a human to get exposed to ultraviolet light is not safe. It can cause irritation to the skin, and it has not been shown to be an effective way to kill the coronavirus, at least not yet. The next question that comes up is, can washing yourself or applying alcohol or chlorine on your body be a good way to kill the coronavirus? And again, the answer is no. There are more risks and side effects to doing that, and certainly not something that we would as medical professionals recommend anyone to do. The question also comes up, can coronavirus, since people think it's transmitted by animals, can our pets transmit it to us? So the answer is no, that domesticated pets do not transfer the coronavirus or transmit them. However, there has been one case now clearly documented where an infected human being has passed on the infection to their pet dog. Now, certainly that would raise the question, can that pet dog now pass it on to other humans? These are questions that still remain unanswered. But it's a very smart idea that after coming in contact with cats, dogs, hamsters, gerbils, rabbits, whatever else it is that you love and care for, it would be a good idea to wash your hands thoroughly with soap and water and dry it with a fresh paper towel or towel that you can then keep for discarding or for washing. The next question that comes up is, are letters and packages that come to us from any of the countries with high case loads, such as China or Italy or Iran or South Korea, safe to receive and use? And generally coronavirus does not survive on objects or surfaces for more than a few hours. So there should be no reason to worry about this. However, the Chinese government has clearly recommended that all the notes, even the currency notes that are being used in China, be sanitized and removed till they are all sanitized and put back in circulation. Similarly, the question comes up, is having garlic juice or having a soup made from garlic effective in preventing coronavirus? So while garlic does have antimicrobial properties, garlic has not been shown to have any specific antiviral properties against the coronavirus. Similarly, people ask, is drinking hot water or warm water a way to prevent yourself from coronavirus? Again, while drinking hot liquids or warm liquids have many other health benefits, it has not been shown to have any direct effect on the coronavirus itself. Though eating warm liquids does protect our immune system from being exposed to cold liquids or cold solids, which do have some effect on lowering our immunity temporarily on the surfaces that they contact. There's also a question, can washing or rinsing your nose with saline protect you from coronavirus? Again, there is no truth to that. However, sinus rinsing and nasal rinsing with saline does have other health benefits for people with allergies or chronic sinusitis or other respiratory diseases, which can be a risk factor for coronavirus, and hence doing that may have benefits in certain segments of the population. There is another myth about using sesame oil to prevent or disinfect coronavirus, and again, the only things that do work in disinfecting are alcohol, bleach, and certain other such solutions that are valuable in cleaning surfaces where the coronavirus might have come as a droplet that settled in that area can become a source of contact transmission. So use the right methods. The next question that comes up is, are antibiotics of any use in coronavirus? And again, antibiotics have no use in coronavirus infections, though some people who get bacterial super infections or what is called bacterial secondary infections could be prescribed an antibiotic for treatment of those secondary infections. Against coronavirus, so far certain anti-malarials, anti-HIV medications and anti-flu or viral medications are being tried with some success, but only in critically ill patients, not in mild to moderate cases. So that, for you friends, is a list of commonly asked questions and myths. Hopefully you're better informed and you can take good care of yourself and your loved ones and your families. And as I always say, if you have symptoms of fever and dry cough with certain high-risk factors, then certainly seek emergency or urgent medical care so that we can diagnose the cases early. We can do contact evaluation of the people that such individuals have been in contact with, and we can do isolation or quarantining to prevent the spread of this very, very infectious disease. With that, stay safe, stay happy, stay healthy, take care. Bye for now.